James, over to you.
Thank you, Chair. My question relates to care homes and the impact of COVID. Clearly been a massive concern. And the access to testing now, how often are members of staff being given access to antigen tests? And how is the rollout of antibody testing going? To Martin Green and perhaps Jane Townson as well, please.
Thank you very much, Dr. Davis. Well, I think what I would say is it's patchy. The first thing to say is that if testing is going to be effective, it's going to have to be a rolling programme of continuous testing. And that needs to be for both staff and also for residents. I also want to see, for example, there are some tests, and there is one programme going on in Hampshire at the moment where you can get test results within about 20 minutes. Now, what we need is that testing rolled out, because that will also help us not only to be able to test staff and residents, but also to be able to test relatives who might want to visit. So I think we've got to get testing as part of an ongoing programme. It is not a once in a in a lifetime activity. It's something that needs to happen regularly. So I think also some of the testing regimes have been too complex. There are too many organisations that are involved, too many websites that people need to go to. You know, some websites are about specialist websites for care providers, then others are about general public access, etc. And I just think we need to have a much more clear, centralised, consistent and also regular approach to testing.
Thank you. So clearly that's pretty urgent, isn't it? As we fight the pandemic, yes. we need to roll this out. There needs to be leadership to make it happen.
Yeah, very much so. And this needs to be now.
Yes, yes. And to what extent are you aware of cases having come into care homes because of lack of access to testing, whether for staff or for residents?
Well, I think at the start of the pandemic, we saw people being discharged from hospital without tests. And of course, that is a major challenge because you might be bringing the pandemic into the care home. And I think one of the things we should acknowledge is that if you look at the residents of care homes, they are all people with several underlying health conditions. They're in the highest category of risk. And I think that was part of the problem at the start of the pandemic, that there was no acknowledgement of that, despite what the Chief Medical Officer said about 3 weeks ago, that they knew that people in care homes were at the highest risk. Well, that didn't translate at the start of the pandemic into a consistent approach to how they supported care homes, and also particularly the way in which primary care withdrew and some of the challenges around that. So I think we've learned some really tough lessons from this. And I hope also, goes back to an earlier point I made for another question, we need to stop focusing on organisations. All the focus was on the NHS as an organisation. It should have been on the most vulnerable citizens and how we protect them, whether it's through social care or the NHS, or in the best of all worlds, a combination of both working together to ensure that people had the highest level of protection.
Thank you very much. And does Jane Townson have any perspectives on these issues?
Yes, so testing has never been seen as a priority for home care right from the beginning. So although it hasn't been reported, we also had people discharged from hospital to home care without testing. Because testing capacity has been limited, home care has been at the bottom of the priority list. So people receiving home care were never even on the list. At one stage, care workers were told that they could all have tests, but the practicalities of accessing them meant that it was, very low levels. You mentioned about antibody testing. None of that has been available for home care. The pilots were all done directed at care homes. There's been nothing available for the large, and I should say that exactly the same number of people work in home care as do in care homes, 685,000 people nationally. It's half the workforce, but it's been largely ignored.